the most common cause of medical bankruptcy. And as Lauren well said, what then brought this to a crisis was that when the constitutionality of the Affordable Care Act was looked at, the Supreme Court upheld in a very close decision, 5-4, as you may remember, in favor of the Affordable Care Act, with one major exception, and that is that the states had the right to decide what to do with Medicaid because it was a shared program between the federal government and the states. So in the state of Idaho, we pretty much put in about 33% of what we get back from Medicaid. 2/3 of that comes from the federal government. Actually, it's about 70% and 30%. So that for Medicaid dollars, we get leveraged on a 70-30 mix so that we can provide coverage for the people in Idaho in regards to Medicaid. Why this has become then an issue is that there are 78,000 people in the state of Idaho that fall into what's called a gap in the Affordable Care Act. To try to expand coverage were two provisions. One was for people to buy health insurance on the exchanges and to get subsidies from 133% up to 400% to have that covered. The second thing was to ideally expand Medicaid. But when different states have decided not to do that, like Idaho has done, then it presents this unbelievably kind of confusing conundrum of people that are less than 100% of federal poverty not being able to qualify for subsidies, but being too poor then to pay for Medicaid. Those people between 100% and 133%, where the subsidies kick in, actually get some degree of subsidy coverage, but they again have incomes that are too low to make the purchase of insurance a viable alternative for them. So there are 78,000 people in this gap in our state of Idaho, less than 100% of poverty, 104,000 people when you extend it up to 133%. Our neighbors, people that work in the restaurants we go to, that make the beds in the hotels we stay in, that work on construction sites, our neighbors, Idaho citizens, not strangers, people that we live with and engage with on a daily basis. So let me put that into context in terms of a little bit of a story so that you can see kind of the impact of this. So I'm going to take the Jones family. The Jones family have 4 members of the family, husband and wife, 2 children that are 11 and 7. They make combined $32,000 a year. Now, federal poverty at 100% or less, you have to understand, is at $11,600 for an individual and $24,000 for a family of 4. Now, nobody chooses to be in poverty. That's a tough place to be if you're making $11,600 a year or less, or $24,000 as a family of 4. So the Jones family of 4 make $32,000 a year. They're above federal poverty. Their insurance premium for 2, because their kids can get covered with CHIP or Medicaid, is $11,000 as an annual premium for the 2 Jones parents. They get $10,000 as a tax credit under the Affordable Care Act to buy their insurance because they're above the cutoff point to then qualify for a subsidy. So health insurance becomes affordable for them because they're only paying $1,000 out of pocket to be covered. Let me take the Smith family now. Family of 4, children that are 13 and 6. The 2 parents combined make $23,000 a year. They fall under the $24,000, 100% federal poverty or less. They have the same $11,000 premium, but they get 0 for a tax credit. All of a sudden, they're looking at an $11,000 out-of-pocket payment when they're making combined $23,000 a year. And you can all of a sudden see how the gap population falls into that gap and they can't afford to pay for health care. That is currently in the state of Idaho, 104,000 people. So with that, what are we going to do about that?
that a cliffhanger or what?
So I'm sorry, Ted.
Sure.
If you have a white Toyota Corolla parked on the Capitol Boulevard side, you are taking up 2 spots. And somebody's gonna make money towing your car. So, if it's not you, don't worry about it, we'll press on. Sorry. Thank you.
Sure. So, where we were was, what are we gonna do about this? We've got some options in the state of Idaho. So Governor Otter convened the Medicaid expansion task force. I think it was a good call in terms of let's pull together some people. Let's take a look at what the facts and the data are. And again, as I said a little bit earlier, my role isn't to take a political side of this argument. I want you just to understand what the issues are so that you can start to listen to the comments and then make an informed decision. So Governor Otter pulled together the Medicaid expansion workforce, and that group has met twice, 3 times in 2012, made a recommendation to the governor, and then for 2 times in 2014 when it was reconvened to relook at the information, relook at the data, relook at what some other states have been doing with this. The task force looked at 5 separate options for the state of Idaho. Number 1, do nothing. Let's keep the status quo as it is. People living sicker, dying younger, people getting reactive health care, ending up in the emergency rooms. That wasn't a real viable option. Number 2 was to redesign the state catastrophic fund and the county indigent care fund. Again, for those that know anything about these 2 funds, it is a totally reactive healthcare system to incident-based care where people get very ill, very sick, end up in the emergency room, end up in the hospitals, and those monies are funded out of both our state income tax and our county property tax. That wasn't felt to be viable either. It's a reactive care system, it's not proactive, it's not promoting better health. Third option was to take a look at the Medicaid system as it is and redesign it. A care management plan which required a state waiver, in which the funds would come from the federal government to Idaho Medicaid, who would then develop a contractor to then cover these 104,000 people, put them into a system that was accountable to the Medicaid system for oversight. The fourth was to take the federal money and to go ahead and buy private insurance coverage for people on the insurance exchange, so that Mr. and Mrs. Jones, they qualify for a subsidy, or in this case do not qualify. They're in that gap population, and the state would then purchase a program for them at the silver level, and that would be their insurance package. Now, the interesting thing about that, because that had some merit, we were thinking about that. Several states, 6 of them, in fact, have looked at that. 2 are actively engaged, Arkansas and Iowa, and they're both running into problems on the financing of that program. It's costing more than they thought. The packages were more expensive than they thought. They had no accountability for what the people were doing within the system. And the 5th option was a direct primary care option, meaning that there was direct payments to primary care providers so that people had access to timely care. The problem there was that, what about the rest of healthcare? If you needed to see a subspecialist, what if you had a catastrophic accident or illness? So you needed high-end coverage as well. So felt that that wasn't viable. So in short, both times, the Medicaid expansion work group voted first time, 2012, 15-0 to the governor to expand Medicaid in Idaho using a Medicaid redesign option. The second time, 2014, we voted 10-3 to expand Medicaid to the state of Idaho using a Medicaid redesign option to the existing administrative structure of the Medicaid program. Now, the reason the vote was 10-3 the second time is that the 3 legislators, both Republican, I'll just put that out there as a factual statement, I'm not taking a side here, said that's dead on arrival in Idaho. Give us a better plan. The work group felt that it absolutely was the best path forward, and And so we pushed on with that recommendation despite the non-unanimous vote the second time. Let me conclude by saying and giving you the 10 reasons that the governor's Medicaid task force on 2 separate occasions felt we should do this in no particular priority order. Number 1, it costs less to Idaho to expand the Medicaid program using the state Medicaid plan option. It'll cost $81 million a year over 10 years to do that. It'll cost $165 million over a 10-year period to do it under the private insurance option. Number 2 is that by having the state plan option with Medicaid, it controls the plan design so that Medicaid has a 3% overhead for administrative fees. The private insurance companies selling private insurance programs on the exchange varies anywhere from a 9 to a 30% administrative overhead. Also, the wraparound services such as transportation and mental health integration would not be worked into those other private plans as they now currently with Medicaid. Number 3, more money for Idaho. Medicaid expansion under the Affordable Care Act for this population of 104,000 people is paid for by the federal government 100% in the first 3 years, and that tapers down to 90% over the rest of the lifetime of Medicaid program in the United States. So at 90-10, 90% from the federal government now, 10% from the state of Idaho, we wrap up 104,000 of the sickest of the sick, and those people that can't get covered because they make too little money to qualify for the subsidies, that catch-22, if you will. The other part of that is that brings in the Medicaid 100% payment in 2016, I'll just use that as an example, brings in $2 billion for the state of Idaho. $2 billion for the state of Idaho. That provides $1.56 billion in gross wages, 43,000 jobs in the state of Idaho, and $132 million in taxes. So the state of Idaho as a whole, writ large, is helped by Medicaid expansion. Number 4 is that the antithesis of that also works. It harms Idaho if that money doesn't come. Let me mention why that is. Absent the Medicaid dollars for health care spending for the uninsured, that pulls money from the rest of the economy, displacing private spending and reducing overall economic activity for the state. Now that's an important thing to consider. The actual non-passage of Medicaid actually harms the state's economy. Now that's something that we all have to be aware of. This is not just a simple thing of deciding yes or no. The actual forbearance of $2 billion to the state actually has a ripple effect then in what it means to the state economy to replace that loss and for those people to continue uninsured. Number 5, the state catastrophic fund, which again is from all of our state income tax, that forms a pool of about $35 million a year that is used one each for people that exceed $10,000 worth of medical expenses in the emergency room and in the hospitals and for their health care. It's totally reactive. There is no control of what's happening with those patients, no primary care for those patients, nothing to integrate and coordinate their care. Similarly, the county indigent fund, again, paid for by all of our property taxes, which totals about $30 million a year, also forms a pool right now. Bless Idaho for doing this years ago. They put in place kind of a safety net, if you will, for people that find themselves in that situation. By bringing Medicaid funding into Idaho, all those people get covered. Not only do they get covered for their health care, they get covered for their proactive primary health care to keep them from needing to be in the emergency room or hospitalized in the first place. It's prevention and wellness, good chronic disease management, instead of reactive sick care or disease care problems along those lines. Number 6, federal income tax. We will continue as Idahoans to pay federal income tax. That's not going away. But what happens with our dollars, then it gets used by the federal government to support other states' Medicaid expansion. So the numbers on this is that 27 states have expanded Medicaid, 21 states, of which Idaho is one, has not. 2 are in some degree of trying to sort this out. We continue to pay federal income tax. That money is shunted to our neighbors in Washington, Oregon, California, and other places where they're expanding Medicaid, to the detriment of Idaho's economy and Idaho's citizens. Number 7, cost shifting. Most of you know how this works. In healthcare, for the cost of the uninsured, that's just not eaten by the hospitals. That's passed back by the hospitals to the insurance companies in contracting next year for increased payment to cover that loss. That's passed on by the insurance companies to employers and individuals in the form of higher premiums to make up for that loss. So all of the unpaid for health care is cost shifted to employers and individuals, and that's why, again, if you're an employer or if you're an individual, you've seen increased premiums, especially over the last 20 years. They've been almost double digit every year. Number 8 of 10, any new money has direct impact on the state's economy. If the federal dollars are not coming to Idaho, they're going elsewhere. Number 9 and number 10, now to the human element of this. Uninsured people live sicker. More sick days, increased absenteeism from school, increased absenteeism from work, decreased production from the Idaho workforce. And lastly, number 10, the uninsured die younger. The data on living sicker and die younger is clear. This isn't fabricated information. And in fact, statistics have been done on the population that are uncovered in this 104,000 people, that there will be 76 to 179 premature deaths per year in this population because of the fact that we've not made the decision. So in summary, the governor's workforce has looked at this carefully twice, 2012, 2014. We looked at all the options. We considered them all. It was really clear to the work group to expand care management option through Idaho Medicaid for the good of the 104,000 uncovered people in Idaho. As I mentioned, in the last vote, the 3 legislators felt that that's not politically feasible in our state, and that we need to give serious consideration to some alternative sort of decision points. We went back as a work group and looked at what the governor asked us to do. The governor's directive was the following: recommend to Idaho and to me as the governor the best path forward regardless of political viability. We did so. It's really clear to the work group. I hope it's clearer to you that there are good reasons to expand Medicaid in Idaho. The economy will be better for it. The economy will be less harmed by it. People will be better served by it. We'll have a healthier workforce that will result from this. And again, I appreciate the Idaho Healthcare for All in calling the meeting tonight, because one thing we did conclude from the workforce, and I'll stop with this, is that we needed to mount a large educational campaign across the state so that informed citizens can better understand the issues, so that they better can understand what it is that has become a pretty big deal and should be a pretty big part of our election. Thank you very much.